The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Today on Aging Horizons, we're going to be speaking with Olivia Ryuta, and she leads the Cover Montana program. And we're going to talk all about what happens if you lost Medicaid coverage during the unwinding period. What are the resources out there for you, and how you might get that coverage back or look into other programs that might assist you. So make sure you stay tuned to this incredibly important information on Aging Horizons.
Montana veterans, your independence matters. The freedom to age with dignity, how and where you want for as long as possible. Please help us improve long-term veteran care in Montana by taking a short online survey. Go to veteransurvey.mt.gov. Your long-term independence is our priority. Go to veteransurvey.mt.gov and help us get it right, Montana. This message brought to you by DPHHS, the Montana Veteran Affairs Division, and this station.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, but my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Katie Lovell. And today we're speaking with Olivia Ryuta, and she is the lead of the Cover Montana program. Olivia, thank you so much for being with us today.
Absolutely. It's always a pleasure to be here.
Tell me a little bit about yourself.
Sure. So I am with the Cover Montana program, but we are a project of the Montana Primary Care Association, where our organization is based out of Helena and works with community health centers statewide. But Cover Montana has been around for about a decade, and it's really focused on connecting Montanans who need health insurance coverage to health insurance coverage programs they might qualify for, whether it's Medicaid or Healthy Montana Kids or the health insurance marketplace.
Sure.
At healthcare.gov. We're really focused on reaching and engaging those Montanans, answering questions, walking through applications, just taking the time that folks need to get enrolled in health insurance coverage that they qualify for.
Wonderful. What an incredibly important service. And I imagine that you guys have been pretty busy with the Medicaid Unwinding. Can we talk a little bit about that?
Yeah, the last time I was here, we were talking about Medicaid Unwinding, so I'll just start off and if people don't inherently know, so during the COVID-19 pandemic, all the folks who were on Medicaid essentially weren't reassessed for eligibility until the pandemic was over.
Sure.
Right? So people kept enrolling, and so the number of folks on Medicaid grew. And then states were given the opportunity to start that process to send everybody a redetermination packet and see if folks still qualify. That started last April of 2023, and the last group of packets went out in Montana in January of 2024. So we have kind of sent out all of the redetermination packets, and what we know is kind of in that process about 1 in 10 Montanans lost coverage.
Okay.
132,000 Montanans so far, and folks lost coverage. We've seen kids coverage loss, kind of adults, and then certainly older Montanans who have lost coverage in that process. What we know is that that a lot of folks who lost coverage did so for procedural reasons, which is just a word for kind of paperwork, right? Essentially, they were asked to send something in and they didn't return that, whether it was the packet, whether it was a verification, kind of you name it, lots of reasons. And so there's a lot of folks who lost coverage who we don't know what they qualify for, right? Yeah. But who might not have health insurance coverage right now. And so we're really trying to think about what those folks need in order to get covered again.
Absolutely, and those could be, simple things, making sure they get reapplying for Medicaid. What types of things can people be looking at in that process?
So there are. So if you're thinking about the kind of groups of people and what they qualify for, so you're really thinking about the folks who still qualify, right? So a lot of folks lost coverage, and we've been talking to them, right? And a lot of folks, first of all, don't know if you lost Medicaid and you think you still qualify, you can enroll at any time, right? Sure. And so I think we hear from folks who say, I didn't know I could re-enroll, and you can certainly re-enroll. Yeah. So for those folks, they need to fill out a Medicaid application and will be assessed their eligibility, right? Because they're not sure. Those folks are people that we help folks enroll in Medicaid all the time, right? We really specialize to helping younger folks, right? So we help a lot of older folks who haven't transitioned to Medicare, and then we work in close partnership with the folks at the area agencies on aging, who are often the leads for folks who are Medicare eligible and then also have some of those Medicaid questions as well.
Absolutely, some of those helping programs.
Yeah, absolutely. And so you can enroll anytime, and your coverage will go back to the first day of the month that you applied. So if you apply May 15th, your coverage and you're eventually approved, your coverage will go back to May 1st. Wonderful. And so I think that's the first thing, right? Those folks to think about who still qualifies for Medicaid and HMK. And then there's folks who no longer qualify, right? Maybe they got a notice that said, hey, you make too much money for Medicaid or Healthy Montana Kids. For those folks, we can work with folks and look at the health insurance marketplace, right? We can fill out an application. Most Montanans qualify for financial support to make that plan more affordable, because affordability is huge. It's always important. I think people are really thinking about affordability these days, or if folks have an offer of employer coverage. We talk to a lot of people who say, I lost Medicaid. I think I have an offer of coverage through my employer or my spouse's employer. We can help answer some of those questions, and so that they can understand how to get enrolled in that employer coverage. And then there's a lot of folks who lost Medicaid who are actually eligible for Medicare, right? During the unwinding, they aged into Medicare, but they were still enrolled in Medicaid. And so those folks, we hear from folks who need to enroll in Medicare, and we say, wonderful, we have great partners in our SHIP counselors and our area agencies on aging, and refer them over to them.
That's really wonderful. And then how does someone know which group that they're in?
So I think if someone is, I would say in general, if you're Medicare eligible, I would start your point person is going to be your area agency on aging.
Sure.
And if you aren't yet Medicare eligible, reach out to us. Cover Montana, we have a team of folks in state who do enrollment help, right? So if you want to do in person, if you want to do over the phone, and we have a phone team that just does phone enrollment as well. And we can put the contact information up for our phone and also our website where you can find more information.
Wonderful. When we get back, I want to talk a little bit some of those steps and some of the things that people are going to need to know to get recovered. So make sure you stay tuned, because we've got lots of really important information, and especially if you lost coverage during that Medicaid unwinding period, you really want to know this information and maybe share it with your community members. So make sure you stay tuned to Aging Horizons.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
Respite. It's okay to need it. It's okay to want it. Will you provide it?
The hard part about having outside help is that there's not a lot of people out there who can do that kind of work. We've been very fortunate that our Bonnie has been with us for 7 years. I don't know what I'd do without her. I need her in our lives. She's our second mother. And I can't help but think of her that way.
To find out how to change lives, including your own, call 800-224-6034 or visit respite.mt.gov.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Like many areas in Montana, Helena is nearly surrounded by forest and is at risk of a devastating urban fire. Wind-blown embers from wildfires have ravaged communities like Denton, Montana, and Boulder, Colorado. Now is the time to prepare your home for wildland fire, no matter where you live. Be aware and prepare. Make you and your community a safer place. Visit firesafemt.org, paid for by FireSafe Helena and aired by the Montana Broadcasters Association.
Welcome back to Aging Horizons. We're speaking with Olivia Ryuta, who leads the Cover Montana program, all about what happened during Medicaid unwinding and how to get recovered. So thank you so much for being here. Really appreciate it. So let's talk a little bit more about how folks get covered again.
Absolutely. So, right, during the Medicaid unwinding process, when the state was reassessing eligibility for those folks enrolled in Medicaid, we saw 132,000 folks lose coverage, about 1 in 10. And then we have talked to a lot of folks who tried really hard, right?
Sure.
They spent time on the public assistance helpline, maybe they went to their OPA, and for some reason or other, they couldn't make it through that process successfully. And so we have decided, because 1 in 10 of Montanans have lost coverage, which is it's just a huge number of folks who've seen a transition in their health insurance coverage. We've decided to launch a statewide re-enrollment campaign.
Okay.
We're calling it Get Covered Again. We know that Montanans value health insurance coverage. They want health insurance coverage. And we need to really work to figure out how to get them covered again in the kinds of health insurance that they qualify for.
Sure.
Some of those folks are going to still qualify for Medicaid or Healthy Montana Kids, and they really need to re-enroll. Some of them are going to transition to health insurance marketplace or an employer plan, and some of them are going to enroll in Medicare because they turned 65 during the pandemic. So Get Covered Again is really, we're saying to Montanans, have you or someone you know? Because the fact of the matter is that we all know somebody who has lost coverage in the last year. And really trying to remind folks that if you've lost coverage, if you're not sure of what you qualify for, if you have questions about the process, right? Health insurance can sometimes be intimidating,
Yeah,
right?
absolutely.
Transitions of health insurance can be intimidating. So we talk to folks, right? If someone was enrolled in Medicaid for a long time and then they're transitioning to the marketplace, that can be a big transition. Or folks who enrolled in Medicaid who are now working to enroll in Medicare, there are more parts to Medicare than there are to Medicaid,
Yeah.
right? So really trying to just take the time to walk folks through that process. So we are out in the media, on billboards, really trying to remind folks that they can get covered again. There are coverage options available. The second piece of that, I would say, if anybody who's watching who is a partner, right? We're trying to talk to Montanans who've lost coverage, but we're also trying to reach our partners who already work with and provide services or have clients who have seen coverage loss.
Yeah.
This is an all hands on deck moment. We need kind of we need a no wrong door approach to identifying folks and reaching them, and then helping them figure out who can help them re-enroll. And so I would say if there's any partners thinking, geez, I have patients or clients or consumers that I work with who are telling me that they've lost coverage, right? We also have information and resources to help our partners help to use their eyes and ears to identify folks, right? There's a bunch of folks who can do the enrollment work, right? But we need eyes and ears on the ground. So if you come in and I'm helping you, and let's say I'm a food bank, and you say, yeah, I need food, but I also have lost my Medicaid. Yeah. How do we make sure that we're having that conversation in that moment to say, Katie, oh, I'm so sorry to hear that. Did you know that there's somebody in Helena who can answer your questions and walk you through that process? And can I sign you up for an appointment with them right now? And so we're really trying to reach kind of the public, but also our partners who are hearing and seeing folks every day who've lost Medicaid or Healthy Montana Kids coverage.
Absolutely. Losing your healthcare coverage can affect so many parts of your life, from your legal needs to your housing. Such an important aspect. Yeah.
Absolutely. And so what I would remind folks, right, so with Get Covered Again, the goal is to get folks to the right people who can help. So if you're thinking, right, if you just tuned in and you're thinking, geez, I've lost coverage, a lot of times it's like my brother or my neighbor or my cousin has lost coverage and they don't know what to do, right? Sure. So for folks who think they still qualify, and they can reach out to Cover Montana. And you don't have to know what you qualify for. You can also call and say, I've lost coverage, I have no idea, right? Yeah. Your job isn't to know. But in general, we can help folks really start and have a conversation. We can fill out a calculator and get a sense of where they should be enrolling. And then generally for folks who are younger than 65, we are a great place to start, Cover Montana. Either our helpline, or if folks are computer savvy and want to do it all online and not talk to anybody, you can do all that through our website as well. And then if folks are over 65, I think the best place to start would be at those area agencies on aging in their community. We try to work as closely as possible so that we are, referring within communities and making sure that we have enough capacity to meet the need. But what we know is that people are already receiving services, they're working with folks in their community, and right, a lot of people don't live in a community where there might be an Office of Public Assistance. Sure. Even if you have an OPA, you have to have transportation to get there, right? Yeah. There's a lot of different barriers. The Public Assistance Helpline, folks can call if there's long wait times. Sometimes that can be challenging. So I think the good news is that there are more folks who can help make sense of this process, right? And so whatever organization, whatever entity, for folks who are listening, that they already work with, that they feel comfortable in, I would say start there. But to know that if you have lost coverage, if you have seen a coverage transition in the last year, right, that there are options available and there are people available to help you through that process. And their help is free, it's confidential.
So incredibly important, all being good neighbors in Mr. Rogers' neighborhood, it feels like. All right, when we get back, we're going to talk a little bit about what happens if you disagree with the outcome of your Medicaid unwinding. So make sure you stay tuned to Aging Horizons.
Can you say ombudsman?
Ombudsman. Ombudsman?
Uma Doodlesman? Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman.
I was the last guy you'd expect to get diabetes. I was a competitive runner and I always took care of myself. So when I was diagnosed, it kind of threw me. But it's really encouraging to know I'm not alone with it. There are a lot of other people going through the same things as I am. It takes some effort. You have to keep after it. Exercise, meds, and diet are the key. But there are a lot of folks who want me to succeed. Diabetes is not the end of the world. With effort and attitude, you can have a normal life.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Welcome back to Aging Horizons. We're speaking with Olivia Ryuta, who leads the Montana Cover program. See, I can't even get that right. And she is telling us all about the Medicaid Unwinding Program and what to do. So we talked a little bit about how to get re-enrolled, but then what happens if you disagree with the decision that the Unwinding Program made?
Right. So we talk to folks all the time who they went through the redetermination process with the Office of Public Assistance, and for some reason they disagree with what was determined. And sometimes that, like, they've lost coverage, and they lost coverage because they didn't send something in on time, right? And they say, I swear and I promise that I put that in the mail in that time frame. Or we've talked to families. I think a classic example these days is, like, you have a family of 4, and 2 of the kids, the parent was redetermined, 2 of the kids redetermined, and there might be a child who lost coverage for some reason. And so we talk to folks, and I think the thing to remember is that anyone applying for public benefits, right, Medicaid, Healthy Montana Kids included, but also SNAP, TANF, that you have a right to basically say, hey, I think that what was determined isn't correct, right? And that is called the administrative review and fair hearing process. I think those words can sound intimidating to folks. So we're trying to talk about it to remind people that this is their right? Because we talk to a lot of people who say, hey, I did it and I don't think it's right. Yeah. And so the answer to that is, right, that you can certainly ask for an administrative review and a fair hearing. So you can essentially have your say to see if that was correct or not. That process is a 2-part process, right? It's first administrative review and then a fair hearing. But essentially the first part is you talk to a caseworker, they look at your case, and you kind of have a more informal conversation. And then the fair hearing is with a judge, and it feels a lot more formal and court-like. But everybody can do that on their own. If you have a friend or family member who you want with you in those meetings, you can certainly do that as well. But people have the right to that process. So to remember that first, right? I will also say that one of the biggest questions we get right now is also about folks who say, okay, I lost coverage in August and I reapplied in November and I haven't heard anything. Yeah. And so I think in those instances, I think there's 3 ways that you can really work to get that resolved. The state of Montana, and any state, right, are supposed to process cases within 45 days. So a new application, if you're reapplying, as long as it doesn't include a disability determination. So for most folks, it doesn't, right? So most folks, their application, so if they're reapplying for coverage, they should find out within 45 days if they qualify. So what happens if that's delayed? And we've seen some of those case processing delays. And I would say that's the other option, that for those folks, they can utilize that fair hearing process. They could certainly go to their OPA or call the Public Assistance Helpline But they also have that fair hearing process to basically say, hey, you all haven't determined anything yet, but it's been over 45 days and I need to know the status of my case. So we're reminding folks about that process because I think there's a lot of Montanans who are kind of in that boat trying to figure out who need access to healthcare and are just waiting to find out if they qualify for Medicaid. And so there's information about the administrative review and fair hearing on our website and also Montana Law Help, which if you don't know, Montana Law Help has a ton of information about a lot of different legal things. So we really lean into them and reference all of their stuff. So just to remind folks of that, because those are a lot of the questions that we are hearing on the phone and in communities right now.
Absolutely. Do you have any tips, any tricks for people who are reapplying to look at that application process?
Sure. So absolutely. I think the biggest thing to remember is that if you are reapplying for coverage and you have any questions, there are people who can help you through that process, number one.
Yeah.
I think that the state of Montana Medicaid has an application portal. It's apply.mt.gov. And we are encouraging folks to utilize that portal. So even if they didn't apply that way, once you have a case number, you can link your case essentially in the portal. But what it is I think just the best, most timely tool to understand your coverage, your renewal dates, and receive your notices. So Montana, we see really, in some communities, really long mail delivery delays, right? So the further you get from Helena, I feel like those delays go up. And so on apply.mt.gov, you can see copies of your notices, and you can get email copies of your notices. So if you're in Sydney, instead of waiting for your notice to come in that says, I need a verification of this bank account, you'll get an email that says, I need a verification, the OPA needs a verification of this bank account, and it gives you a lot more time to meet all of the requests that might come from the Office of Public Assistance to assess whether you're eligible for Medicaid or Healthy Montana Kids, right? So that tool the apply.mt.gov tool can be intimidating. We have a resource that kind of talks you through how to utilize it, how to link your case, how to sign up for those email notices. So we encourage folks to take the time to familiarize yourself with that before you really need it.
Yeah.
And then I think the last thing is to just remind folks about timelines, right?
Yeah.
So if you've lost Medicaid or Healthy Montana Kids and you think you qualify, you can enroll anytime, right? You do not have to wait to enroll. If you no longer qualify and you need to look at the health insurance marketplace, an employer plan, reach out. It's not too late to enroll. And if you have questions about Medicare, right, reach out to those SHIP counselors so that they can really start that process with you. But the thing we want people to remember is that help is available. Help is free. It's confidential. And so when in doubt, if you have questions, reach out because there are people who can help you make sense of this process.
Yeah. Oh, Olivia, thank you so much. This information is so important and so helpful to so many people. And I just thank you so much for being here today.
Absolutely. Thanks for having me.
Thank you for staying tuned to Aging Horizons. We hope you learned something, and make sure you check out that website and get those resources to help yourself and the members of your community to get covered again. Thank you.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.